Alright guys, I'm going to be going over some medical terminology. So for anyone who's taken a foreign language, you'll kind of jive with this a little bit because you kind of are learning your own language, so to speak. Medical terminology is a mix of two different languages. For starters, you have Latin, of course, which is the base for most spoken languages, especially the ones that come from Europe, such as English, Spanish, French, German, Dutch, all of those, they all have some basis in Latin. So some of these words you'll kind of see, they sound like words that we use every day. Where it gets a little complicated is they also have some Greco-Roman language thrown in there, which is what makes them so complicated and sound so strange. So let's start with what abbreviations are. So a lot of us use these every day. So this just simply put the shortening of a word. So you just remove some letters, like for example here, we have BAID, or a blind airway insertion device, which you guys will learn more about in airway, and usually what we use around here is called an iGel. You can look it up, they're pretty cool. We also use a lot of acronyms in medical terminology. So this is your abbreviation of initials that can be pronounced as a word. This is a very common one we use in the medical field, CPAP. So it stands for continuous positive airway pressure. We pronounce this as CPAP when we see it. So you'll see a few different ones like this as you go throughout your career. So I actually made a Quizlet for you guys that has all of these terms on it. So feel free to utilize that. I'm going to give Miss Laura the link so that you guys can utilize it. Use it as much as you'd like, and it may honestly help you throughout your medical career if you stick with it. So a lot of the really common ones here, A&O, alert and oriented. We use this a lot. So we say someone's alert and oriented times 4 or A&O times 4. So they know person, place, time, and event. If they can answer those 4 questions, they're A&O times 4. If they can answer 3 of the 4, they're A&O times 3. If they can answer 2 of those, they're A&O times 2. If they can only answer 1, they're A&O times 1. If they can't answer any of them, they're either nonverbal or they are severely altered. Or A&O times 0, as some people will put it. ACS, acute coronary syndrome, you talk about this a whole lot with CPR especially, and with anything having to do with chest pain. We'll talk about it more in cardiac. AFib or atrial fibrillation, this is a funny heartbeat. AMS is altered mental status, so they're not their normal. So ARF can go one of 2 ways. I know right here I have acute renal failure, and that's typically your common one. Some people, depending on their discipline, will actually say acute respiratory failure. Either one is correct. So if you see ARF, you just need to kind of listen to what they're talking about to figure out if it's renal or if it's respiratory failure. BSI, there's a huge running joke about this with EMT especially, because before modern technology and before we decided there's better ways to test people, we had what we called practical skills. And these practical skills, we'd have to talk everything through. And you guys will do something very similar, but you're not going to be tested on it the way we used to be. We used to actually have to do this whole thing for state and national registry. But the whole running joke was BSI seen safe. So body substance isolation, this means that you're putting on gloves, gown, some means of isolating that bodily substance from you. So if you ever hear someone say BSI, that's what they're talking about. CC is chief complaint, excuse me. So what is the patient complaining of? CO, complains of, so the patient complains of. You can use this when you're writing your reports. CHF is congestive heart failure. So this is fluid backup. So in right-sided heart failure, it backs up to the body, and left-sided backs up to the lungs. I recommend you write that down somewhere because you will 100% see it again, and you'll probably see it again when we do patho and when we do cardiac. CKD is chronic kidney disease, so this is renal failure. You may see it as ARF as well, which is acute renal failure, or well, some also say CRF, which is chronic renal failure, but just depends on who you talk to. COPD is chronic obstructive pulmonary disease. This is a very, very common illness in the elderly. It's also becoming more common in people who are middle-aged that tend to smoke a lot. So these people have a hard time pushing air out of their lungs because their bronchioles get so constricted they can't push air out. So CVA, cerebrovascular attack or a stroke. DM, diabetes mellitus. So the only reason we have DM as diabetes mellitus, there's another type of diabetes called diabetes insipidus, which actually isn't diabetes at all. And when we get to endocrine, I'll elaborate more on that because diabetes is my baby. I'm actually diabetic myself, and I'll be showing you guys some neat diabetic stuff there. DX is diagnosis, so that's just shorthand, so you don't have to write out the whole word. Fracture is FX, So we use this one a lot. It's very common in our reporting systems. HLD is hyperlipidemia. I wouldn't say it's a super common one, but a lot of nurses tend to use this one. So if you ever go into nursing, you'll see it a lot. HPI, I'll be honest with you guys, the only place I've seen this was from one doctor's office when they gave me a patient's chart, and I've only ever seen it on National Registry, which is where I got the basis for doing this slideshow. I did common National Registry medical terminology, so that's what I pulled. That way you guys don't have to go through the entire alphabet and the entire dictionary for medical terminology. HTN is hypertension, if you see it. HX is history. That is a very common one. MI, I'm sure you guys have probably even heard this one before you started class. This is a heart attack, myocardial infarction. Anytime you see the word infarction, it means that you have tissue death, or you have a blockage somewhere. PMH is past medical history. So this is whatever medical problems the patient has had before now. RX can be prescription or treatment. So I'm sure when you guys talked about documentation, you probably saw like if someone uses chart or DRAT, any of those, R is usually treatment. TXP is transport. So I use this one. Not a whole lot of people use it, but if you see TXP, it's transport. WNL. While I like this abbreviation, within normal limits can get you in trouble, so be careful how you utilize it. So, word analysis, as I said at the beginning of this, most of your medical terms are rooted in Latin. So if you can speak either English, Spanish, any of those, they all kind of coincide with Latin. So, best thing you can do with medical terminology is break them down into parts. So the example here I have is hematology. So anytime you see hemat, it means blood. The O is just a linking vowel. A lot of times it's an O or a Y, but it can be others as well. There's some rarer examples. We don't need to go into them because you're probably not going to use them. Anytime you see logi, that suffix means the study of. So you put them together, hematology is the study of blood. So that's kind of how you can break it down. The way that your book recommends it is to look at the end of the word, and then, well, the suffix, and go back to the beginning. You can do it either way, and it still works. It's not a one-trick pony. So compound words are made up of two or more words. So the example I have here is smallpox. So you have roots of words. These are the foundation that is not used by themselves. So therm means heat. Roots that are used in a combining form are typically with a vowel. As I said, it's usually an O or a Y. It just depends on the word. Prefixes, so these are at the beginning of a word. They are used to modify or qualify their meaning. I am so sorry, guys. I'm having trouble speaking today. So, for the example I have here, the root pnea, this relates to breathing. So anytime you see dyspnea, anytime you see dys at the beginning of a word, it means they're not able to do it or it's hard to do. So dyspnea means they're having difficulty breathing. Anytime, and you're going to see this one a lot, tachy. Tachy means fast. Brady means slow. These two are very common. You're going to see them a lot, and you're going to see them typically with cardiac. So tachycardia means a high heart rate. Bradycardia is a slow heart rate. For the example I have here, bradypnea is slow breathing. Tachypnea is fast breathing. Suffixes, so this is the part of the word at the end of the root or the word that completes the meaning. So itis is swelling. Anytime you see itis, just know that you have swelling somewhere, and it kind of gives you an idea of where it's at. So the example I have here is arthritis. So anytime you see arthur or arthro, it refers to joints. So arthritis put together is joint swelling. Pretty self-explanatory. EAC, you won't see this one a lot. There's very few that use this one, but it's someone who suffers from a disease process. So a hemophiliac is someone who suffers from the disease hemophilia. So those people have trouble with blood clotting. So anytime you see philia, a lot of times it means that they have a lack of, or those cells like to repel each other. So it just depends on the meaning. Oh, or maniac. Maniac is someone who suffers from mania. I forgot that example as well. So here's another example I have for you. Cardiologist. So cardio refers to your heart. We know that logi, as I've already stated, refers to the study of something. Ist, if you add that to your logi, it becomes someone who is specialized in that study. So a cardiologist specializes in the heart or the study of the heart. All right, cholecystitis. So, sounds very daunting, but I promise you it's actually a lot simpler than you think. So, anytime you see chole, it's talking about bile. So, that's that icky green stuff that comes from your gallbladder or your liver. Cyst, talks about a closed sac. So, anyone ever had a cyst? You kind of know what I'm talking about here. A lot of times you have to go get those lanced. But in this case, we're talking about an organ. So, cholecysto, together, means bile sac. And then itis, of course, means inflammation. When you put this entire word together, it translates to bile sac inflammation. I'll give you a hint. Your bile sac is your gallbladder because it's right next to your liver. That's what helps put bile into your digestive system. We'll go over that with digestive, obviously. So you have bile sac inflammation, cholecystitis. So you have a gallbladder infection. All right. Here's some of your common roots and words. So adeno means gland. Adreno, do not confuse that with adeno, talks about your adrenal glands. So think about where adrenaline comes from. And the actual meaning of adreno means it's on top of your renal glands, i.e. on top of your kidneys. They kind of look like gnome hats. Go look at it when you get to anatomy and physiology. Adrenalo also means adrenal glands, kind of potato. Arthro, I already kind of went over this one, talks about your joints. Bio means life. If you've ever taken biology, you're studying life, literally. Carcino, this is cancerous or pertaining to cancer. Cardio, as we've said about 10 times now, refers to the heart. Cephalo, this refers to your head. Cerebro actually refers to your cerebrum, so it's actually talking about your brain. So it's different from cephalo. Don't get them confused. Crino means to secrete, so crino usually refers to your hormones, which is very specific to the endocrine system. Cysto, this talks about your bladder. Contrary to what you would think, it's not talking about cysts. Cyto means cell. Dermo or dermato, they kind of couple together. They talk about skin. Electro, this is all about electricity. Encephalo also is very specific to your brain. Entero, so like gastrointestinal, so intestines. So entero usually talks about your intestines. More specifically, it talks about your small intestines. Erythro is red, or eryth without the O. Aesthesio, this talks about sensation, so like pain or pleasure or anything that would cause you to have a reaction, so any kind of sensation. Gastro, so this talks about your stomach. Glyco, this refers to sugar, so anytime you see this, it's usually going to be referring to your blood sugar. We'll talk about that more in endocrine. Nosso, this means knowledge. Gyneco, I'm sure everybody here knows what that is. It's female doctor. They deal with the female reproductive system. Hemo or hemato, this refers to your blood. Hepato, anytime you see that, like hepatitis, refers to your liver. Hypophyso, this refers to your pituitary gland in your brain. We'll go over that more with neuro. Hystero refers to your uterus. Iatro, this talks about treatment. So iatrogenic means that you're going to try to find a treatment. Inguino refers to your groin. Isco means to hold back. Lapro refers to your abdomen. If anyone's ever had like hernia repair or anything, you'll have what's called a laparoscopic surgery. So they make incisions into your abdomen, put air into it, and then they use a tiny instrument to go in and cut whatever they need to out or repair it. Leuco, this talks about white. So more specifically, leukocytes are your white blood cells. Ligamento refers to your ligaments. Mammo refers to breasts. Masto also refers to breasts, so either or, they're kind of interchangeable. Meno refers to menstruation. Meningo talks about the meninges. This is the coating around your nervous system. So your nervous system, your brain, your spinal cord, and all your peripheral nerves, they're all coated with meninges. So whenever you hear about meningitis, it's talking about those being inflamed, and it can cause a lot of damage. Nephro. So this refers to your kidneys because they have nephrons in them. That's why they talk about the kidneys. Neuro refers to your nerves. Pretty self-explanatory. Nosso means disease or disease effect. Obstetro. So this is someone who helps with childbirth. So either a midwife or an obstetrician, which is actually specifically a childbirth surgeon. Onco. This refers to a tumor. It doesn't necessarily have to be cancerous. Ophthalmo, this refers to your eyes. Osteo refers to the bones. Patho refers to diseases. Ped or pedo, This refers to children. Psycho, this refers to your mind. Recto refers to your rectum. Of course, we'll talk about that in GI. Rheumato, this refers to flow, fluids, and joints. So, flow of fluid, it should say. Rhino, this actually refers to your nose. Sarco, this talks about your flesh. And then thrombo talks about clotting. So, going a little further, you have abdomino. This talks about your abdomen. Amnio, so this refers to an amnion, or the sac around the child, if you're pregnant. Angio talks about vessels, so this isn't just veins, it could be arteries as well. Antero is the front. Arterio talks specifically about arteries. Arthero, this actually talks about plaque formation, or a collection of fatty material. So we'll talk about atherosclerosis when we get to cardiology, and it's pretty interesting how that happens. Axillo, this is in your armpit, so we talk a lot about axial temperature that's being taken in your armpit. Or we'll talk about 12-lead placement in cardiology. One of them actually goes in the axillary area, or mid-axillary as we call it, that line that divides you. And I'll actually go over that a little more in this chapter. Broncho, this refers to your bronchial tubes. Cervico, this refers to your neck. Chemo, this is drugs or chemicals. Cholecysto, remember we already talked about this. This is your gallbladder. Chondro is your cartilage, so we'll talk more about that in your musculoskeletal system and anatomy. Chrono, this refers to time. Coccygia, this talks about your tailbone. Colo refers to your colon or your large intestine. Cranio, this refers to your skull. Cryo, this is to be cold or frozen. Epithelio, this refers to your skin. Esophago is the esophagus. Latero is one side. Lumbo is your loin or waist region. Lympho refers to your lymphatic system or lymph. Mediastino, this refers to the mediastinum. This is the space between your lungs but behind your esophagus. Myelo, this is your spinal cord or bone marrow. Necro, this is death. So anytime you see necro anything, it refers to the death of something. Euphor or euphoro, this refers to your ovaries. Orchio, this refers to testicles. So does orchido. Ovario, sounds just like ovary anyway. It pretty much says it without actually saying it. Pelvo, this is the bones of the hip region. Excuse me. Third try's the charm, right? Peritoneo, this refers to your peritoneum. So this is the cavity that is inside your body, in the abdomen. You actually have about 4 or 5 different body cavities. So pharyngia, this is your throat, and then phlebo talks about veins. Pneumono, this is lung or pneumo, so you could see either or, so pneumono or pneumo. Pleuro, this refers to the pleura or the lining of the lungs. Postero, this is back or behind something. Pulmono, as I said, is lungs. Radio, this refers to x-rays, specifically in medicine. Reno, this refers to your kidneys. Sacro, this is your sacrum. Salpingo, this talks about specifically the fallopian tubes. Septic or septico talks about an infection. So we're actually going to talk about a huge disease process in patho called sepsis. And sepsis is very, very deadly, and many, many things can cause it. It's just a very advanced infection. Spine or spina, this refers to your backbones, as it should sound. Teno refers to tendons or tendo. I forgot to put the one with the D in there. Thoraco, this refers to your chest. Tracheo refers to your windpipe or your trachea, as it's anatomically called. Thyroid or thyroida, this refers to your thyroid gland. It's a little gland that's in front of your trachea in your neck. It's kind of shaped like a butterfly. We'll talk very heavily about that in endo, because once we get to endo, there's a big push for teaching these diseases because they're becoming very prevalent. Ure or uro refers to urine or the urinary tract. Vasculo, this talks about blood vessels specifically. Vertebra or vertebro talks about your backbones, so think about your vertebrae. So let's talk about suffixes, so the ends of these words. So I'll give you a hint. A good, I'd say 80% of these pertain to something. So you can see how many here mean they pertain to something. Ac, al, all these different ones. Let's talk more about the ones that aren't meaning pertaining to. So anytime you see algia at the end of a word, it's talking about pain. So, for example, you can have what's called neuralgia. That's nerve pain. So, I'm sure everybody's probably heard of fibromyalgia. So, it's talking about the fibroids of the myelin sheaths. So, you're having nerve pain still. Centesis, this is a surgical puncture to remove fluid. Anytime you see seals, these are actually a hernia. So what a hernia is, it's either fat or an organ or something protruding through a muscular wall that shouldn't. Specifically, you see this with the abdominal cavity a lot, or sadly for men, it winds up happening around their testicles a lot. Ectomy, so this is your surgical removal or excision of something. So we talked about salpingo. A salpingectomy is removal of your fallopian tubes. Emesis, you'll see this one a lot. Emesis by itself means vomit. So if someone's vomiting, we say that they have emesis coming from them. Hematemesis is bloody vomit. So things like that just kind of link together, right? Pretty simple. Emia, this is a blood condition. So sepsis, we'd already talked about that. Septicemia is a systemic blood infection, for example. Anytime you see gram, it's a recording of something. Graphy, so this is your process of recording. So we have electrocardiograms and electrocardiography. So these are the records or the recordings of. Anytime you see genic, this is talking about it's producing something. So cardiogenic, anything, is the heart's producing it. Anytime you see a globin, that's talking about a protein. You won't see it a whole lot at the EMT level, but it's there in case you see it in a registry question. You can kind of figure out what makes that word and what it is. Let's see. If you see megale, that's an enlargement. Lysis, that's a big one you'll see a lot. So, especially when we talk about endocrine, I promise you guys, I do not talk like this all the time. You'll see separation, breakdown, or destruction with lysis. So glycogenolysis, that's talking about the breakdown of new glucose cells, for example. That's kind of a big one, but it's the easiest example I can think of. If you see oma, it's talking about tumor or mass. So like a myeloma is a tumor of the myelin sheath in the nervous system, for example. Anytime you see opsy, this is the view or process of viewing. So like a biopsy, you're looking at cells. People confuse that with just being specific to cancer. Biopsy can be used to look at other things in your cells. Osis, this is an abnormal condition. Pathy is a disease condition. So cardiomyopathy, you're looking at that layer of your heart. Plasty, this is a surgical repair. Anytime you see Raj, this is a discharge of blood. Ragia is also a discharge of blood. So hemorrhage. When you're hemorrhaging, you're losing blood. Rhea. I know we're all going to think diarrhea, right? So it's a flow or discharge. I'm going to give you a new word with rhea at the end. Rhinorrhea. So we already said rhino means nose. So you have a runny nose. Sclerosis. This is a hardening of something. So we talked about sclerosis. That's the hardening of fats. So scope, anytime you see that, it's a visual examination instrument. So laparoscope, this goes inside your abdomen and looks inside. Otoscope goes in your ear and looks inside your ear. I don't know if you guys have ever seen an otoscope. If you've been to the doctor, you've probably had an otoscope in your ear. That's the little thing where they use to look down into it. Anytime you see cyst, this is the state of something. So, meiosis, the dividing of cells, for example. Anytime you see stomy, it's talking about an opening. There are a lot of different ostomies that you'll see out there. So, one of the common ones is a colostomy. So for whatever reason, part of their colon is not operable. So they'll actually have an opening in their abdominal wall and their feces will go into a bag. And it's not a very fun process for them or for anybody really. But that's just an example. You've probably heard of people that have a stoma, especially if they've ever had their part of their throat removed. They'll have a stoma that they talk out of. Or they may not even be able to talk, it just depends. Therapy, anytime you see that, it means treatment. Anytime you see tomy, it's referring to cutting into or an incision. So a craniotomy, you're cutting into the head. Anytime you see urea, it's just as it sounds. It's talking about urine or a urinary condition. So hematuria is blood in the urine. All right, so your common prefixes. There's not a whole lot of these. An or a means no or not. Anytime you see o, it's talking about self. So you're talking about yourself. So autonomy talks about yourself. Dia, this is complete or through. Dis, as I said, means bad, painful, difficult, or abnormal. Endo means within something. Exo, think about like an exoskeleton for a bug. The outside or out of something. Hyper and hypo. Please, 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 please know these. Just like Tacky and Brady. They are very, very common. So hyper means high, excessive, above, or more than normal. Hypo means low, under, below, or less than normal. If you see peri, it's surrounding something. So like the pericardial sac surrounds the heart. Pro, if you see that, we're not talking about like a pro football player or anything. We're talking about before something. So being like proactive about something, taking action before something happens. Re or retro means back or behind. Sub, so below or under. And then trans means across or through. All right, let's talk about anatomy and physiology. And I'll tell you guys, A&P is my baby. I actually kind of have a degree in this. I have a BS in biomedical sciences and psychology. So this is kind of my language. So anatomy is the study of body structure, and physiology is the study of body function. While yes, anatomy is very important, physiology is where you wind up having to have more knowledge, especially in this field. So let's start with anatomical position. You guys have probably seen the drawing of the guy where he's spread out kind of like this. So this is someone facing forward with their palms outwards, and they're standing straight up. So you can divide the body into planes this way. So looking at the midline, this is the dead center of the body. Anytime you hear say midline, we're talking about straight up and down. So anterior or ventral is the front of something. Posterior or dorsal, think like a dorsal fin on a shark. It's on their back, right? So dorsal is back or posterior. Superior, so think about someone being your superior. They're above you, right? Or they outrank you. So this is going to be vertically above something. If you see inferior, we're talking vertically below something. Proximal. Think about close proximity. This is going to be closer to your torso. Distal, so think about distal being distanced. So this is further from your torso. Palmar, this is just as it sounds. This is the palm of your hand. If you hear plantar, this is talking about the sole of your foot. So unilateral, so anytime you see uni, it means one. So lateral meaning side, so one side. Bilateral, so bi means two. So like a bicycle, you have two wheels, both sides in this case. Mid-axillary, this is the line that runs down the center of the body. So this splits you in two equal parts straight down your nose and down your sternum. So mid-axillary, I already talked about this a little bit. This is the center line where your armpit is. Mid-clavicular, so this is at the clavicle. This is pretty much the nipple line as we refer to it. So it goes straight down the clavicle from the center. So it divides that into two regions. So planes of positioning, we have transverse. This looks at the body in halves from the trunk in the top and bottom halves. Sagittal, this is looking at the right or left half of the body and divides you at the midline. Frontal, this divides the body into front and back segments. This is also known as the coronal plane. So here's some examples. So sagittal divides you down the midline. Frontal divides you at the mid-axillary line. And transverse kind of divides at your belly button. And as I said, anterior or ventral is the front of something. Posterior or dorsal is at the back. And then I got some examples of other different directional meanings here. You can kind of look at them in your spare time. So abdominal quadrants. I'm not sure why this got coupled in with this section, but we're going to rock it anyway. So imagine a line that makes kind of a crosshair in your belly. So your right upper quadrant, or your RUQ, houses your liver, right kidney, colon, pancreas, and gallbladder. Your left upper quadrant houses your liver, spleen, stomach, left kidney, colon, and pancreas. The right lower quadrant, this houses your right kidney, your colon, small intestine, ureter, appendix, and bladder. And then your left lower quadrant houses your left kidney, small intestine, colon, ureter, and bladder. So I actually have a visual for you guys. So this one's a little more detailed, but I thought it was the best example I could find. So when we're referring to right and left, and we're talking about a patient, remember we're talking about the patient's right and left. So if you're looking just straight at somebody, their right is going to be your left is going to be their right. So keep that in mind. So your positional terms. So if someone is laying supine, you will see this very, very frequently with National Registry, and we still use this in the field. If they are supine, they're laying on their back. I always think of supination as like holding soup. So you want it upright, correct? So pronation or prone, this is lying face down. This is lying on their abdomen. If you've taken CPR, you probably know this one. Recovery position, this is lying on one side, a lot of times with one of the arms up. So if you're going to put someone in right lateral recumbent, you're going to roll them on their right side with their right arm up. Recovery position is used to help keep their airway clear. So keep that in mind. It's to help keep their tongue out of their throat and help keep their airway clear if they start vomiting. So we prefer this in an unconscious, non-trauma patient, so someone who's not injured. Fowler's position, this is sitting straight up. So this is you sitting in a chair right now. If you're in semi-Fowler's, you're halfway laying back. Or technically, semi-Fowler's is anything that is less than a 90-degree position. So if they're not 90 degrees, then they're semi-Fowler's. So think about your angles. I know math, we all hate it, right? So just some examples here. The top left corner here, this has two names. It's either called SIMS, S-I-M-M-S position, or the birthing position. It's also called lithotomy, L-I-T-H-O-T-O-M-Y, lithotomy position is what you'll commonly hear it, but some people still call it SIMS position. So that's your birthing position in case you see it in a lineup. The guy right below your SIMS person here, or lithotomy position person, this is a left lateral recumbent position. So he's laying on his left side with the left arm out and lying at an angle so that he's not going to choke. So we also have prone, so laying flat on your stomach. Supine, laying on your back. Right and left lateral recumbent are there. Fowler's, sitting straight up. So Trendelenburg, there's a whole lot of back and forth about this position. Technically, as our standards are now, we do not teach this. They used to use it for blood pressure. However, if someone passes out, sometimes this will help them a little bit. If you've ever given blood and passed out, or even just given blood period, a lot of times they elevate your feet. This keeps your blood volume at your core. And the problem with this is, once you lay this person flat, think of it kind of like water shifting in a cup. If you lay the cup on its side, the water's going to level out, right? Well, if you sit it up, it's all going to pool into the bottom. So kind of think of it like that. So if this person's got all this fluid towards their head and the center of their abdomen, when you lay them flat, it's going to level back out and go back down to their feet, and their blood pressure is going to drop again. So you have to be kind of careful with this position. Trendelenburg is defined as the feet being propped up 6 or more inches above the body. And then this other guy down here is also semi-Fowler's. That's commonly our transport position. Because the stretcher usually doesn't sit 100% straight up, but you can still consider someone Fowler's if they're like 80 to 90 degrees. I just want to keep stressing, when you refer to left and right when giving any kind of report, you're talking about the patient's right and left, not yours. You're going to look really dumb if you tell the doctor when you give report that you suspect the patient's having a right-sided stroke when really their left side is what was being affected. So just keep that in mind. So, as I said, Miss Laura is going to give you guys the link that I made for these flashcards. They are yours to use. I don't care if you print them. I don't care if you utilize them. I made them for you guys. So, if you use them, great. If you don't, that's fine too. I'm going to give this to any of my other classes that we do as well. So, hopefully this helps you guys a little bit. If you ever have any questions about them, you can come see us. As I said, this isn't all of the medical terms out there. I would not do that to you guys. There are so many. I only pick the ones that are very specific to National Registry and to EMS. Alright, if you have any questions, let Miss Laura know. Thank you.